Today is a special episode. I am giving you a sneak peek at the intro lecture from my 4-Day Fix program. During this program, we are discussing how a full body approach that directs your attention to movement versus zooming in just at the pain point is actually your way out of these chronic injuries. So take a listen and learn a little bit about an interconnected movement-based approach. So for those of you who don't know me, I'm Kirsten, I am Dr. Wishloff, and I'm going to take you through 4 days of fixing your shit. That's what we're going to do over the next 4 days. This program is targeted at clients. So that's kind of the level that we're going to be talking about. If you are a practitioner and you're watching in on this and you have questions that are a little more high level, save them or put them in the chat or shoot me a message in Instagram. That would be awesome. But I'm going to be teaching kind of at the level of clients because that's actually what this was intended for. Okay, so welcome to the 4-Day Fix. We have run this a few times now and I am so excited. We are doing neck and shoulder. I've been doing these for a little while now and I love them. I love them because it gives me a chance to let you guys see an alternative way to solve a problem. Oftentimes when people see me, they're super frustrated with an injury that is not going away. And oftentimes that is because of the approach that they are taking. And so this 4-Day Fix is going to introduce you into a different type of approach to solving injuries that doesn't react to a pain point. It actually resolves it from the root cause. So that is exactly what we're going to go over the next 4 days. And I'm going to use this presentation to kind of talk you through the process that we're using to figure out your injuries. Welcome, welcome. So what is the difference between this approach and other stuff that you have tried is we are working to heal your movement. We're not chasing your symptoms around. So oftentimes people are really surprised when they meet me or work with me because yes, I do care what your diagnosis is, but what I actually care about is what is causing that diagnosis to happen. So a lot of you guys sent in those video asks, which I love. They were amazing. It gave me a lot of clarity about where your pain points are. But now that movement assessment is going to give me context for what is happening in your body that is leading to that area becoming injured. So what we're going to discuss over the next 4 days is using strategies to heal your movement, which is going to resolve your pain, instead of trying to play like whack-a-mole on all of these pain points that keep jumping up. This approach is what I used with high-level athletes for a decade of time. I worked in high-level sport with Olympians and professional athletes, and the difference between high-level sport and day-to-day clinics is you have to be able to see a problem before it happens. If I wait until an Olympian is hurt to be able to solve their problem, I'm not doing my job. And so in this 4-Day Fix, I'm bringing these strategies of high performance to you guys, and it can apply to anything. No matter who you are and what you do or where your injuries are coming from, there's a strategy to resolve an injury before it even flares up. And I'm going to show you the approach that we're going to take to do that. The approach that we're going to take, and we'll talk about it further, is basically determining what is an actual injury and what is a problem occurring from a compensation, and getting really clear on the origin of the actual problem, because pain isn't going to be super straightforward. So if we think about the usual model, when you guys go for treatment or care, you go because you're in pain. You're like, this hurts, I'm going to reactively get some care, and it kind of feels better for a bit, but then everything just drops off. And then it feels like everything comes back, or it feels like it's good for a while, and then the same old problems keep coming back. Maybe they come back when you go back into working out. Maybe they come back when you go to work. Whatever the case is, this treatment strategy is providing temporary relief, but it's bringing you always back to the exact same starting point. And the challenge with this is you actually haven't changed anything. If someone is going and rubbing your shoulder and moving your shoulder without looking at it within the context of your movement, your hips, your feet, your neck, your jaw, your vestibular system, if you're not seeing the problem with context, you're not understanding why it is happening. And that is what we're going to try to sort out over the next 4 days. So the approach that happens in my programs is a reassessment and or assessment, which is the movement assessment you guys are doing for this neck and shoulder fix. We're then going to reorganize your movement. So that's actually what this 4-day fix is all about, is about reorganizing your body's distribution and movement systems and improving how your body connects and coordinates movement. And what we're going to see at the end of this is what we need to actually focus our recovery energy on, how we support your movement in a way that we can actually rebuild a foundation of movement that's not going to keep that injury reoccurring. So yes, I know that everybody came in here with neck and shoulder injuries, but what we're trying to solve is your movement, which is going to resolve your neck and shoulder injuries. So let's talk through how we're going to do that over the next couple of days. So a little rundown on the program itself. You guys are on the live call. Hey, good job. You made it. The live call is part of your scorecard. We are going to be doing a little draw for a prize at the end. So Jody, I'm actually going to get you to just take a little note of who is showing up on the call, if you can see in the side there. We'll have our show up on the call. We're then going to do 3 days of exercises. So you guys, I sent out day 1 this morning. I'll send out a little reminder again today. On that day 1 workout page, what you're going to get is a primary workout, and you're going to get 2 relief-based exercises. So these primary workouts, I'm going to explain on the Thursday call what each of those says about you and your injury and what you need to focus on. But each of those has kind of a specific purpose of uncovering something within your movement patterns. And so the scorecard, which I'll talk about on the next page, but the scorecard is basically there for you to leave notes. If something feels aggravating, take note of it. If you're like, whoa, every time I get into this position, this hurts. Write down not only this hurts, write down where it hurts, what part of the movement. Go through the cues that I leave in the exercise again and see if reorganizing your movement changes how fast or how intense that pain is, and start to work through the puzzle like that. We not only want to know what is relieving your pain, we also want to know what is aggravating your pain, because that's going to give me information on what is actually happening in your movement patterns that are leading to that overload point. So the primary things to make sure you get done are those workouts, day 1, 2, 3, and the relief sections on each of those workout days is additional stuff for you to explore to see if that's contributing to some of the symptoms that you are having. The last part of this overview is Thursday. We are going to do a call. I'm going to go into more depth with regards to shoulder injuries and neck kind of biomechanics. We're going to talk through what occurred on each of those workout days and what it says about what's going on with your injuries. And then this is the actual build up to the posture revival program. So I run an 8-week program where we go through that cycle. We go through that reviving, rebuilding, recovering process, so that we not only reorganize your movement, we actually build strength onto that foundation. I want to touch base on a couple of client cases because there's a lot of new people in this one, which is super exciting. I want to make sure that you guys still feel like you're in the right spot. Yes, in my clinical practice, I work with high-level athletes, but in my day-to-day online work, I'm trying to reach out to as many people as possible, because all of these principles that I've learned and utilized in high-level sport can be applied into you. And it's usually such easy fixes that people are missing out on because there's usually not practitioners that are taking this approach nearby them. So through the Posture Revival program, we've had a bunch of people go through it at this point. And one of the people actually is Jody, and she is helping me run this program right now. She's on the call. You see her face there. Jody is a dental hygienist, and she found my program. She did it through the winter, and she was at the point she was ready to quit her job. She was like, I cannot do this anymore. My neck is hurting. And I'm going to send you guys the slides out with this so you can read through these testimonials. But we were able to sort out her neck pain by tracing it back to a past knee injury, the surgery that she had had. So this was a really great example of how we took someone who's having an ergonomic problem and we applied these movement-based principles to discover the knee was actually where her neck pain was coming from. And this is why we take a full body approach. And this is a lot of the time why people haven't figured out their injuries yet. Her leg was not able to anchor. It was creating rotation through her system. It was overloading her neck. No matter how many neck stretches she did, no matter how many neck, treatments, whatever she was getting, she was never going to solve that neck injury at her neck. So If that is you, if you are here because you're having postural pain from work, from sitting at the desk, from being in the car, we've definitely got solutions for you. And make sure you're not just looking at your neck. I know that's where you came from to get into this program, but we're taking this full body approach because I think there's going to be some blind spots you're going to find. We also have had people go through this program who are athletes. So a really interesting case that went through this program was Ian. He was a snowboarder, was and is, and he's a snowboard instructor, and he had this chronic ankle injury that was driving him nuts. We sorted out his vestibular system. He had had a concussion, and we were able to resolve his ankle pain by sorting out his vestibular system. So this is why we are doing this full body approach. There's so many blind spots in the current approach that is taken to rehab. I also bring up cases where we're talking about people who are retired. This is Chris. She was in her 60s and she was retired. She wanted to hike. She had hip bursitis. She had neck pain, shoulder pain, and was going for treatments, and everyone was focusing on her hips and rubbing her neck and shoulders. And we were able to sort out her foot pressure and how she was pressurizing her feet. We noted some stuff with her pelvic floor. Neck pain went away, hip bursitis went away, 2 weeks of the program. So if you're targeting the right you're solving for the right problem, these problems come easy breezy. It's just people don't know how to work out all of these problems, but this program is going to show you how. I'll give you one more case study here. Oh, I got two more. Kaylee, she's a musician. I worked with her for a really long time. She was getting numbness tingling into her arms and hands. She was getting massages. Everyone was working through her arms, her neck, her shoulder. She had some stuff going on within her reproductive system. We were able to improve how her core was stabilizing, improve how she was able to pressurize and breathe, and all of that nerve pain in her arms went away. She was able to complete her PhD performance, and it had nothing to do with her arm at all. So we want to make sure that we're always looking through the entirety of the system because the solution is rarely where the pain point is. I've got one more case study, and then we're going to get into how we're going to do this over the next 4 days. I bring up this case study because this is a client who did the program who had frozen shoulder. She had bilateral frozen shoulder, one worse than the other, and she had been going for the usual stuff for frozen shoulder. And usually with frozen shoulder, they spend a lot of energy really aggressively treating your capsule, because that's where it's frozen. And yes, there is certainly some structural damage in the shoulder itself. And I can see through the movement assessments that I've seen in the Facebook group right now, some people are dealing with a frozen shoulder. The most important piece of frozen shoulder is making sure that the structural stuff that's supporting your scapula, your neck, your torso, your obliques, your core is functioning effectively. If it is not functioning effectively, that capsule of the shoulder is going to be doing so much work. It is very, very challenging to get a meaningful change in a frozen shoulder if all of your energy is spent just at that shoulder joint. So during this program, if you are someone who is dealing with frozen shoulder and has joined this program to try to sort out your frozen shoulder, I would encourage you not to push into pain at your shoulder, but instead start to see if you can distribute that force and that motion to other areas before it starts to aggravate the shoulder, starting to see if we can create more support around the shoulder and alleviate the underlying cause for some of that movement deficiency. If you are someone dealing with any structural stuff, please always reach out. I've talked to also people in this program with scoliosis and some different rib cage deformities. Please reach out to me. You can always send me like DM me on Instagram, whatever the case is. And I definitely want to give you some options. It's not always about looking perfect from the outside. With Petra here, we did get a really significant change in the heights and levels of her shoulder. If you are someone with structural issues, we don't have to necessarily get you back to perfect, but we do want to make sure that your movement is diverse. So we want to make sure that we're improving how your body is controlling and distributing motion. So those are a couple of case studies, and I bring these up just so that you guys can kind of see the process and how it's worked for other people in the past and start to see how looking at a bigger picture is going to be really productive for solving some of these chronic injuries you might be dealing with. All right, so let's get some answers for you over the next 4 days. So this program is essentially a way that we can screen your body and its movement. These calls are going to serve as providing kind of education as to how to interpret what's going on in your body as you're going through these exercises. We're not going through Band-Aid fixes. So what you'll see in this program is we're actually not going to do like lacrosse ball stuff and like long hold static stretching. We're not doing stuff that you've already tried because you're here because it didn't work. And so what we're going to go through is a process of improving how your body creates and distributes tension. That is actually what this 4-day fix is all about, is increasing the amount of support your body has. And I'm going to explain why that's important in a couple of slides. Quick touch on this scorecard. Once again, make sure that you're filling out information along the way. And if you guys went into the day 1 workout, there's going to be that section where I'm like, what did you observe? And a little like list of things I want you to put down. Like, did your neck jump into action? Did you notice this? Did you notice that? I want you to just observe how your body is moving and maybe where your compensations are jumping in as you go through this program. I keep it pretty open-ended because I want you to just write what you're feeling or what you observed. And I'm going to give you prompts through the exercises as to, things that would indicate you're using a compensation. But I definitely want you to keep some notes because the notes are actually where the information lies. Whether an exercise makes your pain better or worse, both of those is information about what your body is actually asking for. So the more detailed information you can collect on this scorecard, the better that Thursday call is going to be, the more information you're going to capture out of that Thursday call. So do make sure you're documenting some notes. If you're doing a movement and you do have questions, record yourself doing it and upload it into the Facebook group. That's what that Facebook group is for. All right, let's get into some of the meat and potatoes of what in the heck I'm talking about and what we are going to try to accomplish over the next couple of days. So you may have gathered, based on the stuff that I've talked about up to this point, that pain is not always clear in terms of what is causing it. The spot that is painful might not be the problem area. It might be an area that is not injured at all. You might have gone for imaging on something that you were like, I thought this was really badly hurt because it was in so much pain, and the imaging came back and it was nothing. Conversely, you might be someone who has an injury and there is a lot of structural damage. So you've been going through that rehab process, but then suddenly you're like, oh, something else just started hurting. There was someone in the group, the Facebook group there, who had had an ACL surgery. And she was like, my shoulder started 2 months after that ACL surgery. And I was like, that's a compensation. This shoulder is a compensation because of the way that knee is recovering. So what we want to get clear on is what is actually an injury and what's occurring as the result of a compensation. So the reason it gets really confusing when we're talking about chronic injuries, and most of you guys are here because of chronic injuries, right? It's stuff that hasn't gone away quickly. The problem is sensation when something's really acute. So if you just rolled your ankle, or if you got hit by a ball, or you tripped, or if someone punched you, like if something acute and external to you happens, the pain point matches up with the mechanism, right? It was outside of you, it hit you, and now the thing that hurt you is gone. So those are the types of injuries where you're like, I don't know, I rested, I put some ice on it, and then it kind of just felt okay. And that's usually the approach when you go for care, right? They're trying to figure out what is the spot that hurts. Let's needle it, let's rub it, let's stretch it, let's do whatever, and then hope for the best. This approach, again, it works when the mechanism is outside of you. But when we are dealing with chronic injuries or injuries that are the result of how you move, if you haven't changed how your body is developing and distributing movement, the mechanism hasn't gone away, right? You are still actively hurting your body until you change the way that you're actually moving so that those forces aren't accumulating on that pain point. And most of the time, this is the piece that people are missing when they're trying to solve a chronic injury. They'll rest it, they'll try to strengthen the spot that's hurting, but they haven't changed the way that they move, the way that they're actually creating that pain. So this approach is going to take you from these parts and pieces and zoom you out to see how movement is interconnected in your body. We're going to touch on this over the next 4 days. My posture revival goes through this like step by step by step down to like the big toe and how your eyes are tracking and all of the goods. We're doing big picture stuff in this 4-day fix so that you guys are going to get some big wins. But again, it's all about tracking what days of these workouts are helping and what ones you feel like you're having a difficult time with. So I see a lot of people, both in my programs and in my clinic, that are like, I have a bad neck, and I got a bad knee, and I got a bad hip, and I got a bad ankle. And so you're like, it's so overwhelming. Like if I go in for treatment, they only treat one piece and I don't know what piece to pick. And it's all bad. And you kind of are like overwhelmed, right? You're like, I don't even want to start because every time I try to fix my shoulder, my hip hurts. And every time I try to get back into strength training, my back hurts. The challenge is we're seeing these all as separate problems, and that makes it feel overwhelming. When we try to solve problems by diagnosing them in isolation, especially chronic type problems, it becomes really, really overwhelming. So instead, what we're going to do is start to solve these problems in patterns. So all of these problems are one problem, right? They're one problem with multiple symptoms. So if we correct for the one problem, all 5 of those symptoms go away. And so as we go through these movements, we're trying to organize and collect your movement to prevent what we call a compensation cascade. And so in this example here, this was actually, she was about 20 weeks pregnant when she was going through the program. If you're pregnant, you're welcome to join. You're just a person carrying another person. So we can certainly sort out your stuff. But I think she was attributing a lot of her aches and pains to pregnancy. But when we actually got down to it, it was her foot that was changing how her hip was moving and creating rotation through her system. When we organized her foot and improved how her body created tension up here, all of those compensation-based pains went away, and we were able to get really clear on actually rehabbing her ankle, which was the main pain point. So that is what we were trying to do. We're trying to make it seem less overwhelming and start to get really clear on breaking things into patterns of movement, which is what we're doing in these 3 days. So we have 4 days to chat. We got 3 days of movement, and each of those days connects to a different pattern. These patterns are all about this interconnected approach. So again, when we start to see a problem differently, we can start to understand a different solution. So it starts to become really clear what the actual solution is when we're looking at the pain point in the correct lens. And it starts to feel way less overwhelming. So this is what I'm going to encourage you to do over the next 4 days, is instead of picking apart the little pieces, you're like, this kind of hurt my neck when I did that, or like I felt my shoulder really hot right there. When you watch my workout videos, you're going to hear me go, plant your foot, open your knee, turn your torso, turn your shoulders. Pay attention to those cues and start to focus on how your body is actually creating the movement, and see if the pain points modify based on how you create tension. So as we go through this 4-day fix, we're digging really deep into this concept of interconnected movement. So this is that principle that I was just saying, which is this pattern-based approach. When we are navigating sensation, just as I said before, we want to make sure that we're navigating sensation in terms of not just pain, but in terms of distribution. I feel stretch here. I feel tension here. I feel compression there. Using language to explain a sensation and recording that is more productive than just writing "it hurt." Because pain is some sort of sensation that's gotten amplified to the point of fire alarms. So if you can slow down before the fire alarm set off and realize that it was like, oh, that was too much stretch here, or this was compression here before it became pain, we start to collect a more productive piece of information. If we're on the outside, again, if you're taking a video, it starts to become more clear what's actually happening. When you're inside yourself, sometimes you're like, oh, my back feels really tight. But sometimes that's where all the movement is actually pouring, and it feels tight because it's actually stretched. And we're going to talk about this when it becomes a compensation. So as we go through this, I want you to remember we're working on those patterns of movement. Listen to the cues. And yes, if you feel sensation, don't push into pain. I don't want anyone to leave this feeling like they were like, oh my God, I really tried to force that movement and it hurt. Go super gently into stuff and just listen to what your body is feeling. Listen to the cues that I go through so that you're collecting that movement and distributing it more evenly through the system. So this pain stuff is what we're going to talk about now, and what I want you guys to definitely take away from this program. So if you only listen to one part of this presentation, where am I at? I'm like 29 minutes in. This is the part, press the pause, save this clip. This is the moment. So I want you to realize that sensation is happening in your body where movement is pouring. And this is so important because you are not going to perceive something that's not moving. So a lot of the times people spend tons of their treatment energy, their rehab energy on a piece of their body that is already moving really effectively. It's moving so well, it's taking the movement from other areas of the body and doing that movement as well. And that's what's creating overload. So what I would encourage you to think about is movement flows through your body kind of like a river, right? So when water is pouring down a river, it takes the path of least resistance, right? If you put a rock in the way, it's going to shift and it's going to move and it's going to keep flowing. And the same thing will happen in your body. If your foot can't move, if you can't move your foot, your hip, your back's going to jump in. It's going to be like, no problem. I'll just take that. I can do that. If your shoulder is unable to lift up or move down, your lower back or your neck is going to start doing that for you. Something in your body is going to take over, and that is exactly how a compensation happens. If a compensation in your body has been done right, you won't even know it happened until something else starts to hurt. And this is the challenge when people just think resting or leaving an injury alone made it go away. Yes, the pain went away, but the pain went away because your body compensated. It shifted into somewhere else. If you do that enough times, you run out of compensations and you end up in this presentation where you're like, I can't solve this problem because you've let so many layers of compensation happen. So what we're going to try to do within this 4-day fix is, if we, again, imagine that water flowing down a river, we're going to start trying to take rocks out of the river. And again, the rocks might not be the pain points. The rocks are where movement is not flowing. So if you see when I'm making comments on your guys' movement assessments, I usually pick a couple of areas where you're guarding, so you're not pouring motion, where your body can't open up, or where you're pouring a lot of movement without creating tension. So that's really what I'm looking for when I watch a movement assessment. It doesn't have to be perfect. I'm not going to look at every single piece. My eyes are going to be drawn to where is movement being guarded and where is too much movement going. At its very foundation, that's exactly what we're trying to accomplish here, and redistribute how force is traveling through your body. So we alleviate some of those hot spots and make for a wider river, make it so that movement can get distributed more effectively through the entirety of the system. So just another reiteration here, the blocked parts are going to be spots where you probably don't think you have a problem. And that is why it is tricky to do without filming yourself from the outside, because if you're just going from perception on the inside, your brain is going to perceive where that water is pouring. Your brain is going to feel where movement is pouring and traveling and creating like erosion, right? So within a river, you're going to have erosion where lots of water is traveling. In your body, where there's lots of movement pouring, that's where those hot spots and that inflammation is going to come. So we want to make sure that the water has an opportunity to flow in your body freely, and that we're addressing the correct problem when we are trying to resolve this pain point. So we're going to talk about shoulders because that's what we all came for. So the thing that you came here for is shoulders, and you came here for a neck. But the thing that I'm going to encourage you to think about through the duration of these 4 days is a shoulder problem that comes in this body is very different than a shoulder problem that comes in this body. The solution to these two problems, although the injury is the exact same, are going to be entirely different. So we cannot base our treatment plan on an injury site. We need to base a treatment plan on how that person's body is flowing movement. And this goes through the rest of the body, the rest of the symptoms. The location of the pain is one very small piece of the puzzle, especially when it comes to chronic injuries that are not from external force. When you are dealing with a problem that is happening because of the way your body creates movement, we cannot solve this problem simply at the site of pain. We have to look at the context of what's happening in your body so that we can support that shoulder effectively, so that the work you're doing on the shoulder actually sticks around. It's not just temporary relief. We actually sorted out the root cause of the problem. So when you're actually doing those shoulder strength drills, they stick around. They're purposeful. We've actually sorted out why that shoulder is aggravated or why you're creating all of this neck or upper back tension. once again, to hammer this point home, nothing is going to work in isolation. And I want you guys to take that away. And it can feel overwhelming sometimes to think about it that way, but I'm going to encourage you. And again, on that Thursday call, I'm going to be talking about the patterns of movement that we've explored over the next 4 days. But instead of thinking of a million parts and pieces that are broken or hurt or bothering you, we want to start to understand how movement is pouring in your body and give you strategies to correct and resolve for those imbalances that you have. I put a little caption in here as well on this side. Yes, you guys are coming with sites of damage, right? You can have frozen shoulder, maybe you have a disc herniation in your neck, maybe you have a fusion. There's something structural going on, and that's absolutely true. I'm not going to tell you that structural stuff doesn't hurt or doesn't cause problems. But what we want to do in this program when we have a structural problem is control how your body is compensating around that instead of letting those compensations run free, because the only way that you're going to notice where the movement has poured is when it overloads something else. So I know there's a lot of you guys in here with some structural stuff. We're absolutely going to talk about the structural issues that can come as well. But the takeaway for you guys dealing with structural stuff is making sure we are containing the problem at the site of the damage instead of letting compensations trickle through the system. I put one more little star here, and we'll talk about this more if you guys end up in the 8-week program at the end of all of this. We do talk about these things in the 8-week program, but I bring this up because I know a lot of people join this program who have frozen shoulder. I do want to bring up the idea that hormones can actually influence your tissue. So when it comes to an issue like frozen shoulder, we want to make sure that we're appreciating this is, again, not only happening within the context of your movement systems, it's happening within the context of your body systems. So levels of estrogen are going to change how your connective tissue actually heals. Your metabolism is going to change that. Your genetics is going to change that. If you have hypermobility, if you have different syndromes, we want to take, again, into account a resolution for you that captures the environment and the context that this injury is happening within. We cannot just be like, you have a rotator cuff injury, strengthen your rotator cuff. We have to understand the context in which that problem is happening. So we're predominantly going to be talking about this in a movement-based setting. Once we get into the full program, we do have a detailed intake, and we make sure we touch on those things like hormone levels, history of hypermobility syndromes, et cetera. But the takeaway really here is any sort of injury isn't just an injury that lives in isolation. It is part of the bigger picture of you as a person. So I got a couple more slides and then we're wrapping up. I got about 10 minutes. This is one little section that's going to help you kind of clarify that compensation cascade one more time. So those compensations that we're seeing through the system. We go really into depth into these concepts in the posture revival program. We go through all the planes of motion. We go through all the compensations that can occur. But I want to give you guys an example of how these compensations happen in a little like cartoon fun way. If you haven't gathered it yet from this presentation, don't get caught up in pain. And again, I want to explain how these compensations happen. So as a human, your brain is set and your vestibular system and your visual system is set to have your eyes level on the horizon, and your feet want to be balanced as best as they can, staying out of pain. So those are the two anchor points. In the full posture revival program, we go through vestibular checks and we go through foot pressure a lot. So we want to make sure that these two perception points are working as best as they can because they anchor the rest of the compensations through the body. If we have an injury that occurs at the shoulder, it may cause this to tip down. Now, this doesn't happen in isolation because now we've changed your body's perception of neutral at the eyes and we've changed your body's perception of pressure at the feet. So there's a compensation cascade that'll happen based just on that one shoulder dropping down. And these compensations happen again because your body wants to feel balanced on your feet and it wants to keep your eyes level on the horizon. And so again, we go really into depth in this concept in the full 8-week program in a super approachable way. It's always client-based stuff. If you are a practitioner, we have a practitioner stream where we go into the nitty-gritty and the scientific side of this. But as a client, I want you guys to start to see this and understand how it happens, because often as a client, you're trained to go off of sensation. Like when I'm in pain, I should do something about it. But what I want you to leave with at the end of this 4 days is When I feel like my rotation isn't moving from side to side, that's when I do something about it. Or I add stuff into my training to prevent this compensation from happening. And I want you to start to feel this out in your body, because an injury in one area is going to create a cascade through the rest of the system, because your body wants to stay balanced and it wants to focus on what it wants to focus on. So again, we go into that into big detail in the full program, but I like showing you guys these little stick men because I think conceptually it becomes a little bit easier to understand how a shoulder problem or a foot problem, ankle problem can become a shoulder problem, right? This whole system is working together. And I brought this up earlier, but I'll reiterate it again, is you won't feel compensations happening. You'll feel places and pieces get overloaded, but if your body is doing its job, which it does, and it's trying to help you, I know it doesn't feel like it when you're in pain all the time, but it is actually trying to help you. Your body is going to do these compensations on autopilot. It's going to happen without you noticing. So we got to break out of the idea that I have to wait till I'm in pain to do something about it. We want to start to feel how movement is pouring in your body, and that's what we are going to do over these next 4 days. If you will note, in the 4-day fix, we mostly do things that are based in creating tension. Now, many people are taught when they are hurt to expand and stretch and release muscles and stretch things out. The problem with stretching things out, if I go back to this other slide, is if we are feeling tight, let's say on this side of your neck, right? If this side of your neck is feeling tight, there's a chance that it's feeling tight and the muscles are tight because it's under tension. And so if we always jump to stretching something that feels tight, we don't resolve the underlying cause. So you could release this side of your neck, you can stretch this side of your neck, you can get one of those like hooks. We were talking about that in the Facebook group, and like rub your tight muscles. But what we actually want to do is create more tension through the rest of the system to pull this tight neck back into a place where it's not holding a baseline tension. So it doesn't happen from releasing a muscle. That long-term change doesn't happen from massage. It doesn't happen from stretching. It happens from coordinating and connecting tension, which I know sounds crazy because you're like, it's already tight. Creating supportive tension around muscles that are reacting to feeling unstable is actually the way you break out of that tension cycle. So that is a big part of this program, and also is one of the reasons why we don't have lacrosse ball stuff and we don't have a ton of stretching. There is a time and place for stretching, but I want to make sure that we are starting from a place of creating control and stability. And then we can start to see what is a problem of a muscle shortening or something not being able to move. What needs an aggressive manual like rolling approach, and what is just a problem, again, of a compensation that you're showing up as reactive muscle tightness. So the only way that we can really get clear on that is by starting creating tension and support through the system. And you may start to notice that a lot of your pain points start to go away as soon as your body feels like it's supported. And that's what we're going to go through over the next couple of days as well. And I'll touch on that more on the Thursday call so that it's clear for you guys. Fun. We are right at the end here. So I have got the next 3 days to help guide you guys through this process. And I hope that this presentation gave you some clarity as to what this process is and why we are looking at this in like a full body zoomed out manner. I know you guys are coming in with neck and shoulder issues, but we're taking this 4 days to look at everything in the context of the full body. So we really get a good picture of what is actually hurt and what is just a compensation in your body. So thanks for tuning in live today. The recording will be up later today, and I'll be seeing you guys over the next 4 days.